Good afternoon. My name is Dr. Bailey, and I am the resident veterinarian at Claiborne Farm. And I think that it is quite possible that we had the unfortunate distinction of having the first reported diarrhea case in the foaling season of 2021 outside of normal. On January 16, our first foal was born and had mild diarrhea starting at 3 days of age. And then subsequently, out of the next 71 foals, we had 35 cases, or 49% of them, with diarrhea between January 16 and February 26. And the way that those typically presented would be that the foals were born, and then the first 24 to 48 hours of life, or certainly within the first 5 days of life, they would develop loose, watery stool. In our case, many of them initially had a normal TPR. We didn't see a lot of high temperatures in our cases. Also, the initial presentation of the complete blood count oftentimes was within normal limits, or we might have a mild leukocytosis and left shift. We had only a few cases that had a leukopenia, and those were our most severely affected animals. And at the time of initial presentation, most of the time, the foals that we had were still nursing, but many of them subsequently became dehydrated, anorexic, and depressed, and required more intensive and supportive care. We performed diagnostics on many of those. Of course, we didn't know what the cause of the diarrhea was, and so we started pretty early in the outbreak of disease with diarrhea panels, looking at PCR evidence for multiple organisms. All of them were negative for rotavirus, and we had a fairly good distribution of positive diagnoses for Clostridium perfringens, Enterococcus durans, or Hyrae. And then less commonly, we diagnosed Clostridium difficile or Salmonella. So 18 samples that were collected. Of those, all of them were positive for something on PCR. We didn't have any negative ones. That was 51% of the animals that actually were affected with diarrhea. And then 9 of the samples, in addition, were cultured with aerobic culture. And on culture, our most common diagnoses were E. coli, Enterococcus, and Salmonella. And the Salmonella we'll come back to later. It was not in the early course of the disease that we did see the Salmonella, and we'll discuss the significance of that. Treatment for affected animals was routinely the use of an adsorbent. In our case, we used biosponge most often, broad-spectrum antibiotics, including metronidazole, procaine or potassium penicillin, and amikacin. And then supportive care with Lactaid, sucralfate, IV fluids is indicated. A subset of foals did get IV fluids for 3 to 5 days. And typically our IV fluids were given as boluses. We gave between 0.5 and 1 liters of LRS with 2% dextrose every 4 to 6 hours. And those were supplemented with vitamin B12, vitamin C, vitamin E, and thiamine. 17% of the foals required IV fluid therapy and more intensive supportive care on site. 3 foals total required hospitalization in the course of the disease outbreak. So the diarrhea outbreak happened in the presence of a pretty robust existing foaling biosecurity program. All of the foals at Claiborne were born in a single barn, and that barn is concrete block with poured flooring. The foals were moved to one of 2 nursery barns between 6 and 36 hours of life. Initially, it would have been 12 to 24 hours of life in most cases. In cases where there were other conditions such as varus or valgus instabilities that required intensive care. Sometimes foals were kept in the foaling barn. But as the course of disease went on, we moved them much more quickly out of the foaling barn, trying to keep as little opportunity for contamination as possible in the foaling barn. In the nursery barns, one of them was also a concrete block with poured flooring, and the other one was one of the old wooden tobacco barns that had mats. And I identify those as two separate nursing barns, primarily because we believe that the potential risk for contamination is much greater in barns that have wooden siding and barns that have mats versus poured flooring. But in this case, the diarrhea was very equivalent between all three barns. The mares and foals were allowed turnout in individual paddocks, both at the foaling barn and in the nursery barn. There are approximately half-acre paddocks, and they were kept there individually for about 10 days, and then grouped into 40-acre pastures and moved to the barns where they would ultimately reside after that, after they had been grouped into groups of 10 or more. After the mares and foals left the foaling barn, and after they left the nursery barns, the stalls were completely stripped, washed with a detergent, and then sprayed down with Virkon or bleach and allowed to dry. We tried for 12 to 24 hours, but the reality was oftentimes they were cleaning the barns in the morning, and at 3 or 4 o'clock in the afternoon, the stalls would be used again. So on average, probably was 3 to 12 hours before subsequent use. There were foot mats with Virkon in the high traffic areas of both the nursery barns and the foaling barn, and those were quote unquote changed and cleaned as needed. That was an area where there probably could have been improvement early on, but it had been the protocol for some time before my arrival. So obviously we had both the treatment of affected animals on our mind, but we also pretty quickly realized that we were dealing with a diarrhea that was most likely being spread based on the pattern of disease going from one newborn foal to the next very rapidly. And so we quickly started trying to come up with preventive treatment responses. And so I've divided the data here up by week. And so you can see in week 1, starting January 16, those foals that were born there, they didn't have any preventive treatment because we didn't recognize that we needed it, but we had 4 foals born in that week, and all 4 developed diarrhea. And in the second week, we had instituted metronidazole starting at 12 hours of age, and biosponge and probiotics starting as soon as they get to the nursery barn. In the following week, we then added some antidiarrheal plasma that was administered as via NG tube at the time of plasma administration at 3 to 12 hours of age. And so that was administered as a 500 milliliter bolus via nasogastric tube. In week 4, maintaining the same treatment, we started to approach the plasma a little bit differently and divided the plasma into 2 subsections. 250 milliliters were administered via nasogastric tube, and then 250 milliliters were administered orally in 60 cc increments over the subsequent 36 hours. And that's because we initially thought that maybe the plasma was delaying the onset of diarrhea, but that there wasn't a long enough colonization of IgG in the GI tract to actually inhibit it completely. After some continued disease, we then discussed with internists and other farms about what was going on. And in the 5th week, we decided to attempt attempt PPG, procaine penicillin therapy, once a day, starting before the foal stood up. So immediately on birth, it was administered procaine penicillin, and then received metronidazole and biosponge and probiotic after it was 12 hours of age in all of the cases. So immediately got procaine penicillin, then metronidazole, biosponge, and probiotic, starting at the same pace that we had been giving them before after they were 12 hours old and were entering the nursery barns. We did the same thing in week 6, and in week 7, we stopped the procaine penicillin, but maintained the original treatments. Also, between week 6 and week 7, we made some pretty significant other changes. So that overlays then the graph that you see below, which is on the x-axis, you still have those same weeks 1 through 8, and the incidence of diarrhea is the red bar or red graph. And you can see that in the first week, we had 100% incidence of diarrhea. And then that dropped to around 50% and was maintained at around 50% through week 6, at which point by week 7, we dropped to a very low incidence of diarrhea. And we'll discuss that more. So that initial drop in diarrhea that you made note of there is obviously the indication that we're finally achieving what we wanted. And it seems, based on this graph, that our decrease in diarrhea started in conjunction with the administration of procaine penicillin. And in fact, the procaine penicillin seemed to delay the onset of diarrhea, which starts to get that graph in the right direction, but it didn't end up actually eliminating the diarrhea. And in fact, what we saw starting with the very first foal that got procaine penicillin was an increase in resistance. And so here I would like you to just have a look at the things that are in red or shades of red. So this peak right here and these peaks over here. On the x-axis, you have the numbers that are associated with your sensitivity panel on culture. And so in most cases, low number is going to be associated with that S on culture results. The sensitive antibiotics are going to be down here. And things are going to start to be resistant once you get to 16 or higher, sometimes 8 or higher, depending on what antibiotic it is that you're looking at. And so first of all, you can see that the overall graph here is centered over roughly about a 2. So that suggests that the organisms that we were culturing in this week 2 to 4 time period were largely relatively sensitive. And this was Enterococcus durans primarily. And then you contrast that to Enterococcus durans and Enterococcus faecium that we cultured in week 5 and 6. And you can see that the overall graph is shifted to the right. Now we're shifted centered between 8 and 16. And that these red graphs that I ask you to focus on are very much shifted to the right. And so that these are the penicillins. And that is an indication that we have some early onset, very rapid onset of pretty significant resistance of our Enterococci after administration of penicillin as a preemptive or prophylactic treatment. Also, at the same time as we were doing that, we had an overlap of an increase in salmonella cases. So we had no salmonella cases between week 1 and 5. And in the 6th week, we had 4 cases of salmonella. And some of those salmonella organisms were quite resistant, matching the increase in resistance to penicillins that we saw in our Enterococci. And as a result of those two things happening at the same time between week 5 and week 6, we decided in week 6 that we needed to stop procaine penicillin as a preventive treatment or prophylactic treatment. And we needed to really focus on non-antibiotic prophylaxis. And so that primarily means a very aggressive type of biosecurity. And so as a result of that biosecurity, from the time that we changed our biosecurity protocols, we went from roughly a 30 to 50% or incidence rate of diarrhea to 10 to 15% incidence rate of diarrhea. So the advanced foaling biosecurity that we developed still matched the same protocols sort of in general that we were using before, but we were very focused on making sure that biosecurity was maintained and that everything was disinfected that could possibly disinfected. I know that many farms moved out of their foaling barns and either used different barns to foal or moved to foaling outside in paddocks. We were in the end of February. It was quite a cold time period, and the farm decided that it was not really feasible for us to move at that point. So we developed the following protocol. All foals were still born in that same single foaling barn, which is concrete blocked with poured foaling. And the foals were moved to the same 2 nursery barns between 6 and 36 hours of life, but many more of them were moved there at 6 to 12 hours of life, whereas previously they would have generally stayed until they were 24 hours. The mares and foals were still allowed turnout in individual paddocks for 10 days, and they were still grouped into 40-acre pastures. But in this case, after the foals were large enough to be moved to the 40-acre pastures, instead of staying in the nursery barns to develop that group of 10 horses, they were moved immediately, and the groups of 10 horses were developed in the 40-acre pastures in their final barns. So they were moved out of the nursery barns a little bit faster than previously. The foaling assistants wore gowns, boots, and gloves for the foaling, and then every time someone walked into the stall, they were required to fully gown up with fresh PPE. We reused boots that stayed by the stall in a dedicated bucket for that stall, but gloves were freshly used, and most of the time gowns were freshly used in each case. The mare's mammary glands, stifles, and legs were washed using a single-use cotton with gentle dishwashing soap and a container that could be discarded after each use. There was a fresh new disinfectant mat that was placed in front of the stall, a box of gloves, 3 gowns in front of the full stall placed at the time of foaling. New disinfectant was put into that, and everyone that walked in and out of that stall was meant to step on the disinfectant mat. So if we had a 12-stall barn for our foaling barn, every stall that had a foal with it had its own disinfectant mat, in addition to the disinfectant mats that were at the ends of each barn that we had previously used. And then we limited access to those stalls, so there was a maximum of 3 people in the stall at any time, unless there was an absolute emergency. Likewise, in the nursery barns, there was a fresh disinfectant mat placed in front of each stall. The disinfectant mats were cleaned and refilled twice a day, and were completely emptied, cleaned, and dried after the horses left that barn, and then would be reused after they had been disinfected or allowed to dry in the sun for a period of time. All in all, the total cost just for the disinfectant and disinfectant mats that we purchased was probably in the range of about $15,000. The grooms and veterinary staff wore gowns, boots, gloves on every entry, even just to refill the water, even just to put food in. Every single time anyone went into the stall, we went ahead and gowned up, put boots on and gloves. And we limited handling and limited entries into the stalls by trying to have everything done at the same time if possible. So oftentimes the veterinary staff that was going in to treat the foal would also feed the animal and refill the water at the same time, so that there was less traffic in and out of the stalls in the nursery barns. And the veterinary staff did almost all of the medication on the foals, whereas in other cases of disease, oftentimes the grooms that are in the nursery barns will do that medication. The stalls of all affected animals were then cleaned last after unaffected animals were turned out for the day, and the barn was blown out, and then the hallways were disinfected before animals were brought back into the barn. The stalls, including walls of the stalls, were stripped, cleaned using a power sprayer, in our case brush, and a bleach. They were allowed to dry and then disinfected with Fecal in between horses. So every stall in all three of those barns was cleaned thoroughly in between every horse coming in and out. The disinfectant mats were cleaned and refilled with Fecal daily. The aisleway were cleaned and sprayed down with Fecal daily. And high-touch surfaces were cleaned and sprayed down with Companion, which is a quaternary ammonium compound, twice daily. And also the surfaces in the warm rooms were cleaned and disinfected with dilute bleach or disinfectant on a daily basis. And that included things like the crash cart, the feed cart, the sink, the plasma pole, things that were touched frequently, but mostly were not identified as sources of contamination in previous outbreaks. So the outcome of those changes was that 9 of 96 foals, or 9% of foals born after February 26th, developed diarrhea. 6 cases required no additional treatment other than the routine use of probiotic and biosponge and metronidazole during the first 5 days. And most of those resolved within 72 hours, 3 cases required supportive care or hospitalization. One of them was a case of sepsis, one of them was a case of severe salmonella, and one was a case of Tisser's disease. Those animals were much sicker than the average, even during the height of the outbreak, and may or may not have been directly related to that same diarrhea outbreak. So in conclusion, I just wanted to sort of show how our management of the diarrhea outbreak evolved over time. We were very much focused in error on the potential bacterial component, or at least the secondary bacterial component of the disease, thinking that even if it was a viral outbreak, that the secondary bacteria like Clostridium or Enterococcus might be contributing to the clinical disease, and that we can mitigate that by mitigating or treating the bacterial component. In the end, it was not any treatment that we did that was successful. It was the focused management of biosecurity, the attention to detail by the farm staff, and the willingness of all of the farm staff to buy into really focusing on maintaining cleanliness, limiting contamination, and limiting contact between different foals and animals. Most of the foals that were affected were successfully managed on the farm. And one of the other outcomes that I didn't really focus on was that the severity of disease and the treatment outcome was in no way related to what the fecal flora had. So the cases of salmonella and the cases that had Enterococcus and the cases that had Clostridium or had the two together, there wasn't one group that tended to be sicker than the other group over the course of this particular outbreak. So as a consequence, we have concluded that the bacteria were maybe enhanced in their growth based on the presence of the rotavirus, but that by and large, that was not the primary source of disease. No therapeutic regimen prevented the occurrence of disease. And antibiotic resistance was noted very quickly in foals that received preemptive penicillin. That was immediate. The first foal that received that penicillin had a more resistant enterococcus, and the incidence of resistance was much higher subsequently to that in the 5th and 6th week. Salmonella was first noted in affected foal that had received preemptive penicillin, which made us think that we were shifting or putting pressure on the fecal flora to encourage or allow more resistant and more aggressive bacteria to survive by starting penicillin. Ultimately, aggressive management of biosecurity and environmental contamination prevention prevented the transmission of disease, and cessation of antibiotics had no impact in the outcomes of our cases. With that, I'd like you to thank you for your attention and be happy to answer any questions via email. Obviously, you can contact the organizers of this group or contact me directly at Claiborne Farm, and I would be happy to see anyone who would like to come and visit us or answer any questions that you might have. Thank you very much.